Hello, good afternoon. My name is Juanescobar, and I'm here to present one type of advanced practice nurse, or APN. The one that I choose is Certified Registered Nurse Anesthetist, or CRNA. As we know, there are four types of APNs. One of them is the nurse practitioner. The second one is Certified Nurse Midwife. The third one is Clinical Nurse Specialist. And the fourth one, that is the one that I choose for this presentation, as I mentioned before, is the CRNA. Certified Registered Nurse Anesthetist. One of the objectives of this assignment is to know or to identify the daily direct care activity that this type of APN perform. In this case, the CRNA provide a full range of anesthesia and pain management service in four main categories. One of them is pre-anesthetic evaluation and preparation. The other one is anesthesia induction, maintenance, and emergencies. The third one is post-anesthesia care. And the fourth one is peri-anesthetic and clinical support function. A good point to mention in this slide is that even though CRNA administer anesthesia to patients or pain management medications on patients, when this type of nurse, when this type of APN administer anesthesia, is considered an example of a nursing practice. And for example, in the other side, when an anesthesiologist administers anesthesia to a patient, that is considered a medical practice. So even though it's almost like same activities provided by two different specialists or two different professionals, is considered two different types of practice. In this slide, I will mention the activities that CRNAs are responsible for. In the previous slide, I mentioned four main categories. I will explain in this slide those categories. As we see here, one of the main responsibilities for a CRNA is administer anesthesia during surgical, therapeutic, diagnostic, and obstetric procedures. Also, performing epidural, spinal, or nerve blocks, providing care before, during, or after anesthesia. Examine patients' medical histories for allergies or illnesses to ensure safe provision of pain management. Discussing any contradictions or side effects of anesthesia with patients, and monitoring vital signs during medical procedures. These responsibilities are done usually in a medical or surgical hospital, critical access hospitals also, and mobile surgery centers. Some of them are carried in offices of plastic surgeons, dentists, ophthalmologists, pain management specialists, and other medical professionals. Also, we can see that some CRNAs work in the U.S. military medical facilities. CRNAs work with all members of the perioperative team, including nurses, technicians, surgeons, physicians, physician assistants, anesthesiologists, dentists, podiatrists, and other qualified healthcare professionals. This collaboration or this partnership is to provide the best care for patients. The collaboration also includes the patient assessment and plan of care for anesthesia care. At the same time, this collaboration occurs also with patients, so a mutually agreeable anesthetic plan can be developed. Procedures, risks, and benefits associated with the anesthetics are discussed. Another objective that I want to show in these slides and this presentation is the importance of guidance and coaching for the Certified Registered Nurse Anesthetist. Because of the short time that these CRNAs are with patients, CRNAs are challenged to develop a rapport with their patients rapidly and develop a mutually agreed on plan for anesthesia care. So for that, coaching and teaching patient and family is very important to avoid post-procedures complications. For example, patients who undergo outpatient surgery receive coaching from CRNAs about activity, dietary limitation, and use of postoperative analgesics. Patients and their family in this situation also need coaching about when it may be appropriate for them to contact the office of the surgical or anesthesia provider. Families of infants and children who undergo surgery and anesthesia need to be coached by the CRNA regarding the assessment and management of pain, postoperative nausea, and vomiting. The last objective of this assignment is to show you the leadership opportunities that certified registered nurse anesthetists have. As we know, nurse anesthesia has grown and prospered as an advanced practice nursing specialty because of the clinical experience and leadership demonstrated by the generation of CRNAs. One of these examples can be when Alice McGaw and Agatha Hopkins from France during World War I taught the anesthetic techniques to physicians and nurses from around the world. And we can say that CRNA leadership often involves participation in elected and appointed positions at the local, regional, and national levels. We can see, for example, at the local level, CRNAs may serve on a chair of committees in the clinical and academic area in which they practice. The level of responsibility shouldered by a CRNAs in the clinical area provides skills in rapid information processing and decision making, which may be helpful in governance activities such as committees. Something very important in this part is that I think, as I read about this topic, that CRNAs are very helpful and very necessary in this country, especially in this moment that we're living with this change in the health system. We can see, for example, in the city, we can find doctors, we can find medical anesthesiologists all over the hospitals. But if we go in rural areas, as I read, the only specialist providing anesthesia to patients is not a medical doctor, is not an anesthesiologist, is a CRNA. So that teaches us, or that shows us, that this type of APN has a very big area to grow. So it's a very interesting for me. I think that right now I'm studying and I'm focusing on becoming a nurse practitioner because I would like to be in a primary care setting to prevent diseases, prevent complications. But I will think that my second option will be certified registered nurse anesthetist. Is very interesting how they help patients. I hope you have enjoyed these presentations. In the next slide is going to be the reference. If you have any question, you can ask me, you can comment in the tools, you can type, and I will answer you back. Thank you so much, and I hope you have a wonderful weekend. Again, thank you so much for your attention, and I will be very happy to answer you if you have any questions about this presentation. Also, I will try to review your presentation as long as I can during the weekend. And if I have any question about your presentation, I'm going to ask you as a comment, right? So thank you so much. Thank you, Professor. Thank you, classmates. Have a wonderful weekend.